Chapter 9, Part 2. Alcohol. Alcohol can be used as both an antiseptic and a disinfectant. Both ethyl and isopropyl rubbing alcohol have good disinfecting properties. One of the challenges when using alcohol as a disinfectant is that to achieve a reasonable level of disinfection, the alcohol must remain in wet contact with the surface or object being disinfected for a minimum of 5 minutes. Alcohol evaporates quickly, and maintaining wet contact for an extended period of time can be difficult. In figure 9.6 above, highlighted in blue, reviews basic information about alcohol. I'm going to read you figure 9.6, summary of ethyl and isopropyl alcohol. Advantages. Rapid bactericidal agents against vegetative microorganisms, tuberculocidal, fungicidal, and virucidal. Ethyl isopropyl is not effective against hydrophilic viruses. Fast acting, no residue, and non-staining. Disadvantages. Requires wet contact of at least 5 minutes to achieve a reasonable level of disinfection. No residual activity. Volatile, flammable. Inactivated by organic material. Can dissolve lens mountings or certain optical instruments. Tends to harden and swell plastic tubing, including polyethylene. And non-sporicidal. Uses. To disinfect fixed equipment after cleaning and for patient use items such as ear specula, stethoscopes, etc. And can be used as a drying agent. Antiseptic or disinfectant. Antiseptics are used on living tissue such as skins, for example, receiving an alcohol prep before an annual flu shot. Disinfectants are used on inanimate objects, for example, disinfecting a piece of equipment between uses. Phenolics. Phenolics are an intermediate level or low level disinfectant containing phenol, which has a long history of use. During the 1800s, Dr. Joseph Lister used phenol to develop aseptic surgical techniques. Phenolic compounds have long been the agent of choice for housekeeping services because a residual phenolic film is left after use, and that film could be reactivated later by damp mopping. However, the same residual film can be a problem when left on medical devices. For example, irritation of sensitive skin can occur after exposure of phenolic residues. Like all disinfectants for maximum disinfectant effectiveness, phenolics require a specific time for wet contact. Figure 9.7 reviews the basic information about phenolics. I'm going to jump to the next page and review on page 166. Figure 9.7, Summary of Phenolic. Advantages. Broad spectrum of use. Bactericidal for gram-negative and gram-positive bacteria. Fungicidal and tuberculocidal. Active against lipophilic viruses. Residual activity. Note, this can also be a disadvantage. Disadvantages. Non-sporicidal. Inactivated by organic material, but less than some other disinfectants. Corrosive to some plastics. Uses. Housekeeping usage for walls, floors, countertops, and furnishings. Phenolics are used in the decontamination area for disinfection of hard surfaces. Copious rinsing is required to eliminate the potential for skin burns. Back to page 165. Stainless steel instruments should not be subjected to strong phenolics for a prolonged period of time because phenolics can be corrosive. Some plastics also react poorly to phenolics. Follow the device manufacturer's instruction for use for the types of materials that can withstand disinfectant and phenolics. Chlorine. Chlorine is an intermediate level disinfectant that is commonly used for the treatment of water and sewage. Chlorine, a member of the halogen family, may be found in CS departments as a hypochlorite solution often recommended for biohazard cleanup procedures. However, chlorine is not considered a disinfectant of choice for CS due to its corrosive qualities. Metal instruments subjected to chlorine may have their finishes damaged by exposure to chlorine solution. Figure 9.8 at the bottom of page 166 reviews the basic information about chlorine. I'm now going to go to figure 9.8, highlighted in blue, and read the summary of chlorine. Summary of chlorine. Advantages. Effective against gram-positive and gram-negative vegetative microorganisms, tuberculocidal, fungicidal, and virucidal. Fast-acting. Disadvantages. Inactivated by organic matter, corrosive to metals, non-sporicidal, stains fabric, plastics, and other synthetic materials, relatively unstable. Uses. Widely used for disinfection of dialysis machines, hydrotherapy baths, toilets, lavatories, and bathtubs. Also used as a bleach for laundry and as a sanitizer for dishwashing. A 1 to 10 dilution of 5.25% sodium hypochlorite has been recommended by the CDC for cleaning blood spills. Must remain wet on items to be disinfected 1 to 2.5 minutes, and check the manufacturer's instruction for use. Iodophores. Iodophores are buffered iodines that are also members of the halogen family. Like alcohol, iodophores are used both as antiseptics and disinfectants. The best known and most widely used iodophore is povidone iodine. Iodophores can stain both skin and patient equipment. Iodophores should not be used in surgical instruments. Figure 9.9 summarizes basic information about iodophores. On the bottom of page 167, highlighted in blue, is figure 9.9, summary of iodophores, which I'm going to read. Summary of iodophores. Advantages. Bactericidal, virucidal, and tuberculocidal. Rapid action against vegetative bacteria. Disadvantages. Corrosive to metals unless combined with an anti-corrosive agent when formulated. Detrimental to some plastics. Stains fabric and other materials. May require long contact time to kill some fungus. Uses. Used in skin preparations. Disinfection of some equipment. The corrosive nature of iodine on metals and some plastics limits its use as a primary disinfectant in central service, and must remain wet on items to be disinfected for at least 2 minutes. Check the manufacturer's instructions for use. Glutaraldehyde. Glutaraldehyde is a high-level disinfectant, or HLD, used for semi-critical devices such as endoscopes and ultrasonic probes. Glutaraldehyde is compatible with materials used in many modern medical devices and can be used to process medical devices containing heat-sensitive materials. It kills microorganisms by alkylation of proteins. Glutaraldehyde is usually a clear liquid that turns color when activated. See figure 911 for an example. And it has a sharp, pungent odor. It is a strong irritant to the skin, eyes, and respiratory system. Nitrile or butyl gloves and face and eye protection should be used when working with glutaraldehyde. Following immersion in a glutaraldehyde solution, instructions for rinsing items should be carefully followed to ensure the chemical is completely removed. Care must be taken to ensure that this item is not recontaminated. Glutaraldehyde should be used in a separate designated area. Any room where glutaraldehyde is used should be well ventilated with a minimum of 10 air exchanges per hour. When a dedicated area is not available, glutaraldehyde disinfection may be performed at an enclosed workstation. These self-contained workstations manage airflow and reduce exposure to fumes. Figure 9.12 shows some examples of these stations. Unused glutaraldehyde solution should be stored in a cool, secure location in a tightly closed, properly marked containers labeled with the activation date. Definitions. Alkylation. A chemical reaction where hydrogen is replaced with an alkyl group. This causes the cell to be unable to normally metabolize or reproduce, or both. Activated or activation. Process by which the solution is combined with an activating chemical before use. Glutaraldehydes must be activated before initial use. Glutaraldehyde-based products can be used in automated or manual high-level disinfectant process. Most glutaraldehyde-based instruments disinfectants are labeled for reuse for 14 to 28 days. During the recommended reuse period, the concentration of glutaraldehyde in the solution should be tested with test strips recommended by the manufacturer. If the solution fails below its minimum recommended concentration, MEC, if it falls below its MEC level, it should be discarded, regardless of how many days the solution has been in use. Glutaraldehyde vapors increase whenever the solution is agitated, such as when it is poured into or dumped out of a soaking bin. Exposure levels for CS technicians during disposal can be reduced by adding a glutaraldehyde neutralizing agent to the solution prior to disposal. Consult state and local requirements and manufacturer's instructions for use for proper disposal measures.